David, thank you very much. Christine, if you can finish up, and then we're going to go to questions and answers of the panel.
Right. I get to bring up the rear here. There we go. Hi, my name is Kristen Miller, and I'm director of the New York program at the Corporation for Supportive Housing. Thank you for this opportunity to testify before this very important task force. CSH has a 25-year track record of innovation and investment in New York. Since 1991, CSH has made over $138 million in loans to supportive housing developers for the creation of over 15,000 permanent, supportive, and affordable housing units in the state. CSH applauds the efforts of the Senate Task Force on Heroin and Opioid Addiction and the leadership of the senators before us today, Murphy, Amador, Robert Ort, and Martin Golden. Thank you for elevating this issue and keeping it in the spotlight where it belongs. As we've heard again and again this afternoon, heroin and opioids are destroying people's lives, damaging families and neighborhoods. I am here today to talk about supportive housing, a proven solution and valuable tool in our fight to stem this epidemic. We know that housing is a platform for health and recovery. CSH recently released a report called Supportive Housing's Vital Role in Addressing the Opioid Epidemic in New York State, and it provides a background of the opioid epidemic in New York communities, as we've heard today, but it also cites research showing supportive housing as a solution for individuals facing substance use disorders. For those who don't know, supportive housing combines affordable housing with services, with voluntary services that help people facing complex challenges live with stability, autonomy, and dignity. It has been demonstrated that through that stability found in the supportive housing, people using heroin successfully avail themselves to the services that address their substance use disorder. And this goes to what the doctor from Department of Health was talking about in harm reduction, housing first tactics. In 2014, the National Center on Addiction and Substance Abuse found that supportive housing was successful in reducing the use of and costs associated with substance abuse and crisis care services, including everything that we've been talking about today: shelters, detox centers, jails, and medical care, which includes hospitalizations and emergency room visits. These findings suggest that individuals actively using substances can be housed successfully and stabilized without forcing treatment requirements upon them. We, at CSH, in early fall, released a statewide supportive housing need assessment using state data, that using 2013 data, and found that across the state, New York needs 32,000 units of supportive housing. And based on local community input, we believe that 50 to 95% of those people are suffering from substance use disorders. So we know here in New York that supportive housing is an answer. And I especially want to thank Senator Golden, who led 26 of his Senate colleagues, 11 of whom also serve on this task force, in sending a letter to Governor Cuomo calling on him to fund new supportive housing units across the state. During Governor Cuomo's State of the State address, he did indeed commit to creating 20,000 new units of supportive housing statewide over the next 15 years. These units are in addition to the 15,000 units Mayor de Blasio announced for New York City last November. And really, thank you so much for leading that effort. It was very, very crucial. We congratulate the mayor and the governor in taking this important step to housing our most vulnerable New Yorkers. And what we want to do is urge this task force to help us ensure that these new units are realized and that people and communities struggling with the opioid epidemic have access to them and the important services they will need to achieve their recovery. Housing is an essential anchor of stability. Home forms a firm platform from which individuals can pursue the services they need. It is our responsibility to make sure they have access to the services as well as housing. And I echo the comments just made by my colleague here about siting. We need this housing in every community. It is permanent housing. It is not a group home. It is not a shelter. It is permanent housing, and this neighborhood and neighborhoods across the state need it. Communities need to welcome it. And if you can help your colleagues to understand what it is and how much it's needed and how helpful it is, we would greatly appreciate it. Without this housing, individuals struggling with the opioid or heroin addiction will continue to cycle endlessly between homelessness, expensive public service delivery systems, including the inpatient hospital beds, psych centers, detox services, jails, and prisons at enormous public and human cost. So specifically, we believe that we understand that the governor has put 6,000 units of supportive housing in the current budget before us, and as part of his 5-year housing plan. Not yet released, but this is what we understand. We also believe that there's $2.6 billion in the budget, $2.4 billion in capital financing to build the bricks and mortar for this housing, and an additional $200 million in services and operating dollars. We believe that HCR has been allocated $1.9 billion for new homelessness, through its new homelessness and housing plan. So we ask that you and your colleagues on the task force ensure that this recent commitment to the new supportive housing in New York is realized through this year's budget allocation, and that these resources are accessible to heroin, opioid addicts who are struggling with their disorder, trying to recover, and giving them that stability they need. Thank you very much.
Christine, thank you very much. You know, we got caught in that war between the mayor and the governor over the supportive housing. I don't care how it gets done, but it's got to get done. And I believe that the powers that be are coming together on these issues. That and 421A, we believe, is a very important component to housing. We have 8.5 million, probably closer to 9 million people living here in the city of New York. We don't have nearly enough housing, and the mere fact that we have 60,000 homeless on the street is very telling. And so we need to do more in that particular area, especially here in this great city. Karen and David, I wanted to pop off the education to you again, that question about the do we start early enough in our educational system in teaching our children, and does the curriculum have to be addressed? And David, going back to you after that question, you're asking for a rewrite on an SOP, standard operating procedure here in the city of New York, from going directly to emergency room to directly to treatment center. Can that be done? And what the person A has to be willing to do. B, it still has to go through a emergency room, I'm pretty sure, before they can get you to where you want to be. But is there some tweaks that we can do and some changes that we can do in a standard operating procedure to make it much easier to get that person into detox and into long-term care if needed? Let's start with those two, and then my colleague will have some backup questions, I'm sure, on these questions of his own. Go ahead, Karen.
I don't know the specifics of the curriculum exactly. What I do know is that many schools are struggling with not having supplemental services alongside, the academics, such as counseling and mental health services, and those are all considered prevention services. I visited a school about a month ago, not far from my office, and we had heard that they were looking for people to come in and provide, education around HIV, around hepatitis C, around drug use, and when they when they realized that we would come in and do it for free, they almost cried. Apparently, the Board of Education is not giving a lot of schools what they need. There is a new initiative I know that's out there around mental health, but in order for a school to get them, they have to already be struggling. They have to be one of the schools that, you know, gets on the so-called list, you know, for closing, and then they put the mental health services in. So, you know, again, I can't speak to the curriculum, but, you know, part of prevention is those supportive services, and I believe that those are inadequate.
In order for the state to reach their goal of $6.2 billion in healthcare delivery service reform, they're going to need to start reducing avoidable hospital admissions by 25%. I don't know what the law is called that when someone comes into the emergency room they need to be seen, so I'm not familiar with what it's called, but I know they need to be. We have been to several hospital systems and offered a triage service within the emergency room to have that person screened very, very quickly and then get screened for a substance abuse or mental health diagnosis, particularly a substance abuse diagnosis, because that's what they're seeing. We have been rebuffed. No one wants to do that yet because the hospital systems are making a lot of money admitting people through their emergency room and getting emergency room visits. Whether there can be a rewrite of that or a tweaking of that, I have no idea. You guys know way more about that than I do. But in order for the state, and in order for patient care to get better, we need to stop getting patients seen in the emergency room for diagnoses and issues that need to be seen in a community-based provider, such as mine and all the other folks on this panel right now.
Thank you. George?
You know, not so much questions, but just comment. And Karen, on the education, you're 100% correct. What I've been finding throughout the state is most of the education going into the schools, it's done maybe at a 5th grade level, and that's about it. And I really believe that the state ed department should be including some curriculum that is going to carry on with the student throughout, not just 5th grade, but beyond, all the way to graduation. If we can go to a science class or sex education class to learn about various diseases or contraception or whatever it may be, there should be some type of curriculum that is really meaningful to the student when they graduate about substance abuse. There's no question that they're going to be trying alcohol at the school after school parties or after the prom or whatever. They're going to be trying the gateway drugs, and if we can continue to be in front of them with that type of education, hopefully it could prevent a severe abuse of that and an addiction. So, to David, I just loved your direct comments of, you know, it's a mindset that, as Senator Golden says, it's a protocol. How do we change something like that? It's fascinating, and I'm glad that you brought it up because it's a great suggestion. Sometimes our ERs are absolutely full of other patients of, you know, having a cardiac arrest, and then there's someone waiting to get detox. Maybe there's a different measure or treatment or somewhere in the hospital that one of you as a provider could even partner with possibly, so that in that window of opportunity, as Mr. Fusco was talking about, we're not waiting 48 to 72 hours or a decision 6 days later whether they're going to be able to get the treatment, because that individual probably is already on another binge after that. So we need to get to them almost instantly. But other than that, I think Senator Golden, what I've heard in Brooklyn is very similar to what I've heard in other parts of the state, whether it's in a very rural county like Yates County, very small county with 20,000 people, but yet the drug court is filled with individuals, over 200 cases heroin cases in a county of only 20,000. Figure that out. And their overdose rates are just through the roof, skyrocketing because they have small population, but they don't have the services that I hear that we have here in Brooklyn. They wish they had the services, but yet you have so many great suggestions here, and I just look forward to continuing to work with my colleagues on this task force and finalizing our task force report so that we can get the much needed legislation or budgetary items with appropriations in so that more services and more recovery efforts can be for treatment and prevention, and also with the law enforcement component. So thank you so much for all of your time and for educating me.
I just need, I got to assume what I'm going to, you know, you pointed out that nobody wants it in their backyard. You know, I've been to your place, the Dynamite, I've been across Brooklyn, and as my colleague George has. And you know what? I don't see people hanging outside smoking cigarettes. I don't see big, huge signs. I don't see disruption of cars coming and going. It seems to be like, you know, like part of the tree line in the community. Maybe you could explain some of what the misconceptions are of these types of locations.
I think it's an old conception, a misconception of what maybe used to be. I think the program, we're an inpatient program. These folks do supportive housing and outpatient programs. I'd venture to say the folks in my program and the folks at their programs are probably using less drugs than the people that are complaining across the street. We relocated from New York City 8 years ago out to Queens, and we were supposed to actually, the building we went to was an old hospital that was going to be a dorm at St. John's University. And they said they didn't want us there because college kids don't use drugs or alcohol. So it's a mindset. It's a stigma. I think there's a destigmatization of addiction in this state. I think Oasis has done a terrific job of legislation that you gentlemen have passed about access to care. I think it's working. People are getting treatment. We've been a great neighbor for 8 years in Queens, and I think I think most of us legitimate providers are good neighbors. We're not perfect, but we work closely with our elected representatives. We bring business and industry to our areas where our 300 employees go out to eat and use the neighborhood services. And we're smart enough, and we know how to take care of our patients and keep them from, for the most part, bothering people and being a nuisance in the neighborhood. Again, we're not perfect, but nobody is.
Thank you. I'd like to now go to the audience. Does anybody in the audience have any questions for the panel? Yes, sir. Right here, James.
Hi, Jim.
Hold on. Microphone.
Hi, thank you. Jim Schneider, Dynamic Youth Community. I work with Bill, Karen, and all these young guys here. Senator Amador, earlier you mentioned, my boss was talking about access to treatment. And you said, what can Oasis do better? I just want to bring up the tremendous paperwork burden. We get somebody in the program, and bam, we're hit with deadlines. This has to be done in 24 hours. This has to be done in 72 hours. This has to be done in 30 days. We're a long-term program. Everything we do has to be documented very quickly, and it's turning our case records into the size of phone books. It's turning our policy procedure manual also to the size of 2 phone books, and it's just something that if you could look at, I would appreciate it. 819 regulations, 822 regulations, 800 regulations. Just a comment.
Well, I'm glad you brought up the term regulations because, you know, we don't have enough time for me to get on the soapbox and talk about New York State and the over-regulations that could choke a horse. And it's one of the difficulties that we all have, attracting businesses, economic development, and the services that we have that cannot be as inexpensive as they should be because you have to hire more people, more staff, to fulfill the obligations that a bureaucracy or an agency or the state government puts on your lap. And it's unfortunate because you're in business to give care and to help someone in need, and not to fill out a telephone book of paperwork. And if you don't fill it out correctly, or your I dotted and T crossed, reimbursements are withheld, or you could potentially go out of business because they'll put a cease and desist order on you. So it's unfortunate, and it's a whole nother topic that we've been working on and a frustration. So I totally get it, and I understand that. I just didn't want to bring it up in those comments because it opens up a whole spectrum of conversation. But thank you so much for the
Thank you.
question. I appreciate it.
Any other questions from the audience? Yes, sir.
Good evening, everybody. My name is Gennady Kogan. I'm here as a social work student. I also work in mental health field, and I intern in a substance abuse program. While I was listening, I was able to do some research. So there is a bill, A 6763, which is to mandate a licensed social worker to be in a school. Other than that, working in the mental health field, I'm seeing peer advocacy services being great support, and within the mental health field, there are respite centers that are set up across the city that provide services. You know, a mental health recipient can go in and receive services for 2 weeks, no questions asked. One question, is this something that could work for individuals with addictions? Also, I believe Bill was speaking in regards to having adequate staff. Being an intern in a substance abuse program, I'm seeing how difficult it is to get qualified staff. So I guess one of the things to ask is more funding for tuition reimbursement and ease of access to tuition reimbursement for those that are interested in working with this in-need population. Thank you.
Great.
Thank you.
Thank you very much. Any other questions from the audience? I want to thank each and every one of you here today for being part of this. I want to thank the panel for the outstanding testimony that we got here today. If you could leave that here, we'd appreciate your testimony. If you have any ideas, if you put them to memo or letter form and get them to this task force, we will address it. I want to thank the majority leader for setting up all of these cameras and for allowing us to have this task force meeting here in Dyker Heights. I want to thank not only the community board and others, the 6-8 precinct, and of course all of our other those that testified today from NYPD, from the Special Prosecutor's Office, and from the Department of Health. I also want to thank my staff that's here today, John Quaglione, James McClellan, Jerry Cassar, Anthony Testaverde, Marco Kempe. I'm sure I left out somebody. But I also want to thank Doug Brickell, who's the Chief of Staff for George Amador, for being here as well. They have to go back to Albany now, which is about for me, 2.5 hours, for them 3. But I want to thank George for being here, and of course I want to thank the Chairman Murphy for him coming down as well, and of course the other members of this task force. We will get this addressed. Will we get it solved? No. This is going to be an ongoing effort by all of us. But I will tell you, you have the ears of the New York State Senate, the governor, and the Assembly. We will get legislation passed. We will get money directed to this direct issue here in our communities for housing, for detox, for residential units, possibly changing the operating procedures that are now in place to opening up more access and to dealing with the families from the beginning of the process right through the unfortunate tragedies that we see day to day. So you guys in the audience that are in recovery, all I can say to you is God bless you all. Absolutely. Thank you. This is a gift from God. Please appreciate it each and every moment. Thank you. God bless you. And have a safe trip home.